see the shoulders, everything is visible. This is
Around 1.74 million children under the age of 5 face acute malnutrition in northeastern states of Nigeria. The long-running Islamic insurgency has uprooted millions. Food shortages have been caused by farmers who have been forced to abandon their crops.
To start with, he had measles. We were admitted to this center for a week. In that room, after we were discharged and returned home, he began to vomit and have diarrhea, so I brought him back. I thank God that he hasn't vomited or had diarrhea again since I brought him back.
Medical centers that care for the most critical patients are overflowing with children in need of urgent assistance, their hunger visible by their protruding ribs and swollen bellies.
We thank God. We are grateful. We do have problems as we are poor. We are financially weak, and we don't have reliable means of income to make a living. Our husbands don't have stable work. Sometimes they work as bricklayers, and the work is not frequent. But we thank God despite our situation. If we spend the day without eating, we still manage to get something to eat before going to bed.
10 years ago, the threat of jihadist violence forced farmers to abandon their land outside the village of Gonglugong in northern Nigeria's Borno state. Their only option was to work a plot of land that was less fertile but was relatively safe. Nigeria's jihadist insurgency has shifted and evolved since it began in 2009. Boko Haram militants have lost ground to military offensives and forced to battle rivals linked to the Islamic State group. But for farmers, the grinding war remains a constant menace that keeps them from their land, making hunger, starvation, and malnutrition to persist in Nigeria.
This is a stabilization center, so those here are the ones having medical complication together with the severe acute malnutrition. So every patient here is malnourished and they have medical complication.
Doctors have been trying to get the children to gain weight, whose bodies are deformed by the hunger. According to the UN, some 370,000 children under the age of 5 face a high risk of mortality, and 5,000 children are at risk of dying.
It's because of the crisis, the community usually famine becomes a problem. They don't go to food. They have problem of food insufficiency. Also, the health facilities there are in poor states. Also, poor water sanitation and hygiene facilities. So there is bound to be diseases. So I think the major problem is food, poor access to food, and the poor health and the wash services.
The 13-year-old insurgency is primarily responsible for the region's food crisis, but the recent floods, which destroyed thousands of farms in the region, double-digit inflation caused by the coronavirus, and the Russian offensive in Ukraine are additional factors, worsening an already catastrophic situation.